tracts in the dorsal white column. So these tracts conveys the following information from various parts of the body, that is fine touch, tactile localization, and 2-point discrimination, pressure, vibration, proprioception, kinesthetic sensation, and some unconscious kinesthetic impulses to the cerebellum via external arcuate fibers, and some they convey superficial reflexes as well. Fine touch pathway. So in fine touch pathway, the receptors, therefore both fine and crude touch, Messinus corpuscles, Merkel's corpuscles, or Pacinian corpuscles. The first order neurons, the impulses are carried from the receptor to the spinal cord by the fasciculus gracilis and cuneatus by A beta fibers. Some touch impulses are also conducted via C fibers, but they do not relay there. Fasciculus gracilis receives afferents from the lower half, that is lumbar and sacral segment. Fasciculus cuneatus receives afferents from upper half, that is cervical and thoracic segments. Above the mid-thoracic region, fibers from the spinal cord are represented as a sacral to cervical segment from medial to lateral in the spinal cord. Majority of the fibers in the medulla, in the nucleus gracilis and nucleus cuneatus respectively, where they are first relay station. Second order neuron arises from the nucleus gracilis and nucleus cuneatus. They are divided into two groups, external arcuate fibers and internal arcuate fibers. External arcuate fibers, again they get divided into dorsal and ventral group. Dorsal fibers, they enter into the inferior cerebellar peduncle of the same side to end in the cerebellum, and they also the ventral fibers, they are going to reach to the cerebellum, that is particularly opposite side of the cerebellum via superior peduncle. Internal arcuate fibers, they cross the opposite side and pass through the midbrain in the medial lemniscus to end in the specific relay nuclei of thalamus, that is ventroposterior nuclei. So this forms the second relay station. The third order neurons, they pass via posterior limb of the internal capsule to end in the sensory cortex. So this is the diagram showing the dorsal column tract, where all the afferent fibers from the different parts of the body, from the opposite side of the body, they are going to enter into the nucleus gracilis and nucleus cuneatus without crossing in the spinal cord to reach to the medulla. From there, the second order neuron, they are going to decussate in medulla to reach the opposite spinal cord. Then in the medulla, from the medulla, they ascend up to the cortex to reach the ventroposterior nucleus, so which forms the second order neurons, and third order neurons from the thalamus to reach to the sensory cortex, that is area number 312. So this forms the dorsal column tract. If you see the organization of the fibers in the spinal cord, in the fasciculus gracilis, they mainly the fibers from the sacral and lumbar segment, whereas fascicular cuneatus, they contains fibers from thoracic and cervical parts. So usually the fibers which are carried from the cervical and thoracic, they are present in the lateral part of the spinal cord, and the fibers which are carried from the lumbar and sacral segment,